Welcome to this Babies Can't Wait online presentation focused on Child Find. The Department of Public Health is responsible for ensuring that a system is in place to meet Georgia's responsibilities for identifying, evaluating, and meeting the needs of children who are eligible for services under Part C. This system is guided by the comprehensive Child Find System standards that are the topic of this presentation. Hello, I'm Jade Costin, a member of the Babies Can't Wait Technical Assistance Unit through my faculty work at Valdosta State University. At VSU, I serve as a faculty member in the Department of Communication Sciences and Disorders. As an SLP, I, along with the other members of Georgia's Babies Can't Wait Technical Assistance Unit, have focused my career on developing expertise in early intervention, including the requirements of Part C of the Individuals with Disabilities Education Act, or IDEA. As the statute and its associated regulations change, and as our knowledge base of effective, evidence-based practices grows, Georgia's Babies Can't Wait program standards are continuously reviewed and revised as appropriate. Please allow me to serve as your guide today as we take a brief overview of the highlights of Georgia's revised standards. In the next few minutes, you will learn more about updated standards for Georgia's comprehensive Child Find system for identifying, locating, and evaluating infants and toddlers with disabilities who are eligible for services under Part C of IDEA. Please take time to review the updated standards and become familiar with the content. This PowerPoint will only highlight a few areas, but the effective early intervention practitioner should be familiar with all aspects of the standards. The first section of the standards, formatted with bold text, contains excerpts from the actual federal policy. The second section of the standards, formatted with regular text, contains Georgia's standards for implementing early intervention. Bookmarks have been added to each section of the standards linked to this presentation to facilitate navigation. Once the file is opened, click on the bookmark icon located to the left of the text to open the Bookmarks pane. On October 28, 2011, the Secretary of Education issued the final regulations governing the Early Intervention Program for infants and toddlers with disabilities. These regulations were needed to reflect changes made to the Individuals with Disabilities Education Act, or IDEA, as amended by the Individuals with Disabilities Education Improvement Act of 2004. These final regulations identified three major components of early intervention systems. State systems must include these three components: pre-referral policies and procedures, referral policies and procedures, and post-referral policies and procedures that ensure compliance with the timeline requirements, including screening if applicable, evaluations and assessments, and development, review, and implementation of IFSPs. This presentation will explore the pre-referral policies and procedures requirements. The federal regulations identify two distinct areas of pre-referral activities. The first is a public awareness program, and the second is a comprehensive child find system. The Department of Public Health is responsible for ensuring that a comprehensive child find system is in place, which includes all infants and toddlers with disabilities in the state who are eligible for services under Part C. This includes, but is not limited to, those who are homeless, are in foster care, or have been determined to have been subjected to abuse or neglect. This comprehensive child find system must assure that children eligible under Part C will be identified, located, and evaluated, and an effective method is developed and implemented to determine which children are receiving needed early intervention services and which children might be eligible but are not receiving these services. Child Find is a high priority and accounts for 2 of the 14 indicators that Georgia must report on each year to the Office of Special Education Programs, or OSEP. To identify, locate, and evaluate all eligible infants and toddlers efficiently and effectively, as mandated by federal regulations, requires teamwork. The federal regulations require that the lead agency, in this case Babies Can't Wait, coordinates with all other major efforts to locate and identify children by other state agencies responsible for administrating the various education, health, and social service programs relevant to Part C. The lead agency must take steps to ensure that there will not be unnecessary duplication of effort by the programs, and the state will make use of the resources available through each public agency and early intervention service provider in the state to implement the Child Find system in an effective manner. The public awareness program must focus on both internal audiences and external audiences to involve and communicate with major organizations throughout the state that have a direct interest in Part C. This includes public agencies that provide early intervention services as well as other services or are sources of funding for early intervention services. Internal audiences include all appropriate state agencies and their local offices, including but not limited to the Department of Public Health, or DPH, the Department of Human Services, or DHS, the Division of Family and Children Services, or DFACS, both Child Protection and Child Welfare, the Department of Behavioral Health and Developmental Disabilities, or DBH-DD, the Department of Community Health, or DCH, the Department of Education, or DOE, the Department of Early Care and Learning, or DCAL, or Bright from the Start. The Governor's Office for Children and Families and the local district personnel who work with infants and children and early intervention, for example, Women, Infant, and Children Nutrition, Birth Care, Children's Medical Services, Universal Newborn Hearing Screening, Newborn Metabolic Genetic Screening, Children First, and others. It should be noted that the new federal regulations have identified 2 additional programs that must be included. They are the State Early Hearing Detection and Intervention System, or EHDI, under the Department of Public Health, and Children's Health Insurance Program, or CHIP, which in Georgia falls under the Department of Community Health. External audiences include the medical community, including physicians, hospitals, all birthing facilities, and regional perinatal centers. Newly added to the Georgia standards is that a particular emphasis will be given to the hospital, neonatal intensive care units, or NICUs, and regional perinatal centers specializing in the care of infants who were born premature and/or with complications. External audiences also include advocates, public and private service providers, parents or legal guardians, organizations such as civic, business, professional, and faith-based organizations, homeless family and domestic violence shelters, child care and early learning programs, which include Early Head Start, educators and teachers, tribes, tribal organizations, and consortia. The Public Awareness Program must provide detailed information on the availability of early intervention services, a description of how the Child Find system works, how to refer a child under the age of 3 for evaluation or for EI services, and a central directory of information on available EI services, supports, and projects within the state that is easily accessible to the general public. Each system must include a central directory that is accessible to the general public through the lead agency's website and other appropriate communication means. The central directory must include accurate, up-to-date information about public and private EI services, resources, and experts available in the state. Public and private EI services, resources, and experts available at the district, county, and community levels, scientifically based research and demonstration projects being conducted in the state, professional and other groups that provide assistance to children eligible under Part C and their families, and training opportunities, for example, continuing education courses, in-service training, and professional meetings. The standards require the implementation of comprehensive, well-planned, and targeted outreach and public awareness activities at the state, district, and county level. These activities should include use of population and program data to inform outreach, use of family and child risk factors to predict and identify children who are most likely to have significant developmental delays, identification of suspected developmental delays using a developmental screener which would trigger a referral to BCW. Provision of information about BCW to other public health programs and child care providers that may serve potentially eligible children. Health districts shall participate in community events at least once per quarter to increase awareness. Education and awareness activities with physicians, hospitals, community agencies, and the general public to ensure that they understand BCW and the functions of Children First as the MCH or Maternal and Child Health System's single point of entry or front door to these programs, including BCW, and how this referral process benefits children, families, and providers. A new requirement has been added by the current federal regulations. Public awareness activities must provide for informing all parents of toddlers with disabilities of the availability of services under Section 619 of the Act. Georgia standards require that all parents served under Part C be informed about preschool programs under Part B. This information must be provided no fewer than 90 days before the toddler's 3rd birthday. Additionally, subsection 303.117 states that each system must include a central directory that is accessible to the general public through the lead agency's website and other appropriate communication means, and includes accurate, up-to-date information. Georgia's updated standards now require Children First coordinators to be responsible for maintaining resource directories to be distributed to families and community providers. The Great Start Georgia Information and Referral Center will be responsible for assisting Children First in maintaining a local and statewide resource directory. Each health district is responsible for disseminating information about the central directory throughout their local catchment area. It has always been the expectation that local Georgia public health districts will collaborate and coordinate local child find efforts with other agencies who provide services to children birth to 3, such as Early Head Start and Head Start, maternal child health programs, child care facilities, and DFACs. The new standards further delineate the following collaborative partners: early hearing detection and intervention systems, family homeless shelters, perinatal centers, tribal organizations, and organizations serving military families. Local Interagency Coordinating Councils, or LICCs, provide an important mechanism for building a collaborative relationship between the local EI program, family members, and community stakeholders, such as schools, DFACs, and other community providers and programs that serve children birth to 5. One of the roles of the LICCs is to make recommendations for activities to promote child find in their local districts. Given that BCW is a family-centered program, it is very important to encourage the active participation of families in the LICCs. Families that have experienced Babies Can't Wait can provide invaluable guidance to the program. There are many agencies, resources, and programs that provide supports to families of children with special needs. It can often be difficult and confusing for families and professionals to determine where a family should start when seeking help. Federal standards help counter this problem by requiring that EI programs adopt procedures for assisting referral sources and families in obtaining information regarding the referral process to early intervention. Georgia has streamlined the referral process by creating a single point of entry for referrals of children birth to 5 years of age to public health services, including EI, provided through Babies Can't Wait. Children First is Georgia's maternal and child health program's single point of entry. Referral sources, such as child care or physician communities, are informed through a variety of methods about referral procedures and the benefits of referring children birth to 5 years of age through the single point of entry, Children First. In addition to coming through Children First, referrals may come directly to BCW from families, other agencies, or the public. Referrals and screening. If the referral is sent directly to Babies Can't Wait, the family information will be gathered on the Children First screening and referral form and sent to Children First in order to be presented at the weekly staffing meeting to be reviewed by the Birth to 5 review team. This will help to ensure the most appropriate referral or referrals are made on behalf of the child and family. The Birth to 5 review team is composed of a representative from each child health program and will include BCW, Children First, Universal Newborn Hearing Screening and Intervention, and Children's Medical Services. The team shall meet at minimum once per week to review referrals and the disposition of the referrals. Referrals to Children First are made as soon as possible, but not more than 7 days after a child has been identified. Once the public agency receives a referral, it shall appoint a service coordinator as soon as possible. Within 45 days after the program receives a referral, the public agency shall complete the evaluation and assessment activities and hold an IFSP meeting. Day 1 of the 45-day time period begins on the day that the Children First single point of entry receives the referral. Districts must work together to develop a process that maximizes the amount of time available for scheduling and evaluation and developing an IFSP within the 45 days. If a child is referred less than 45 days from his or her 3rd birthday, the local lead agency is not required to complete an evaluation or hold an IFSP meeting. However, if that child may be eligible for preschool services or services under Part B, the lead agency, with the parental consent, must refer the toddler to the State Education Agency, or SEA, and the appropriate local education agency, or LEA. Again, please note that this requirement is a new requirement under the most recently adopted federal regulations. BCW referral sources. Remember that Day 1 of the 45-day time period begins on the day that the Children First single point of entry receives the referral. Examples of BCW referrals include the following: a physician-initiated referral due to a suspected developmental delay or Category 1 diagnosis, a CAPTA referral made by a DFACS caseworker for a child birth to 3 with substantiated abuse or neglect, a referral received from a parent, hospital, or licensed professional with a Category 1 eligibility, a referral received from a parent, family member, or child care provider who is concerned about the child's development. The referral source may or may not mention BCW. Category 1 referral process. Category 1 eligibility refers to eligibility for a child who has a physical or mental condition that has a high probability of, or is known to result in, significant developmental delay. The child is required to have an established risk of developmental delay that has been confirmed by a qualified healthcare professional and documented in writing. The child does not have to yet manifest a delay at the time of identification. A Category 1 conditions list was developed that includes a description of these diagnoses to ensure statewide consistency and equity in Category 1 eligibility determination. These conditions result in automatic eligibility for BCW in Georgia. A link has been provided to a PDF version of Georgia's Category 1 list. You may also contact the EI coordinator for your district or visit the BCW website for the most recent list. A referral from any source for a child with Category 1 condition should follow the following process. Upon receipt of the referral by Children First, the 45-day timeline begins. Category 1 referrals are sent by Children First directly to BCW within 2 business days of identification. The referral is sent to the next staff meeting of the Birth to 5 review team, which consists of representatives from BCW, Children First, First Care, UNHSI, Children's Medical Services, Child Health Coordinators, or some combination thereof. The team will determine the most appropriate public health program referral or referrals. BCW receives the referral, completes the BCW intake process, and enrolls the child if appropriate. Category 2 Conditions Referral Process. The developmental specialist or other trained DPH staff will initiate contact with the family within 3 business days. Staff will use at least 2 unique forms of contact, which may include a telephone call, letter, or home visit. Once contact has been made with the family, a home visit will be scheduled to gain consent to screen the child's development using the appropriate Ages and Stages Questionnaire, ASQ3, 3rd edition. The developmental specialist or other ASQ-trained DPH staff will complete the ASQ Social and Emotional Questionnaire, or ASQ-SE, if 1. The Children First screening and referral form indicates mental health or social emotional concerns and the child is at least 6 months of age. 2. After the review of the overall questions section of the ASQ3, there is an indication that a social emotional concern warrants an ASQ-SE screening. Or 3. A score in the black or gray area of the ASQ3 personal social area. If the screening indicates possible developmental delays, then Children First will send the referral along with the ASQ3 and ASQ-SE, if completed, to BCW within 2 business days. It is important to note that parents can ask for an evaluation even if the child passes the screening. If the child is not eligible for BCW, they are enrolled, with parental permission, in Children First and the Maternal Child Health Integrated Assessment, or MCH, is completed. Thank you for allowing me to serve as your guide today as we completed a brief overview of the highlights of Georgia's revised standards for its comprehensive child find system. A printable PDF version of the Comprehensive Child Find System section of the standards, as well as this presentation, have been provided for you on the References and Resources slide. If you have any questions after reviewing the standards, please contact the Early Intervention Coordinator for your district. References and Resources. Babies Can't Wait Program Standards. provides a link to a printable version of the BCW standards for the Comprehensive Child Fine System. IDEA Part C, Federal Regulations, provides a direct link to the Federal Register as published by the United States government. These final regulations were issued on September 28, 2011 to reflect the changes made to IDEA as amended in 2004. PowerPoint handout. Links to a printable PDF version of this presentation. Public Law 108-446. Individuals with Disabilities Education Improvement Act of 2004 links to a copy of the actual act from 2004 reauthorizing the Individuals with Disabilities Education Act.